was very lucky and fortunate to be exposed to neuro-rehabilitation very early in my career, which became my passion. I was very fortunate to witness traumatic brain injury patients go from lying flat on their back in ICUs to returning back to integrated community lives and being productive in those lives and being able to be part of their families. There are many traumatic brain injury survivors who, for one reason or another, whether it's their condition or whether they were unfortunate to not have great rehabilitation experiences, that do not get to return to maximizing their full potential after a traumatic brain injury. And this is why I'm encouraged to talk at this conference, because I do believe that certainly effective rehabilitation can make a dramatic impact on the patient's lives, as well as the cost for healthcare services within the UAE. Traumatic brain injury is a very, very complex condition that is very difficult for us to define in a very simple way. Basically, the brain it's the control center of the entire body. It controls your thoughts, your emotions, your movement, your feelings of any sensation, whether it's your vision, your taste, your smell. It also is the control center for your vital organs and your vital functions for living, so your breathing, for example. So when the brain is injured, many of these functions can be affected. If one can imagine any kind of ball, and this ball is filled with vermicelli spaghetti, which is the real skinny, spindly spaghetti, and that is encompassed in some water. And if you took that ball and threw it really hard and fast at a very hard wall, you can only imagine what might happen to that vermicelli spaghetti. Most of the strands will likely break, and therefore the connections between one piece of spaghetti and the other are probably not going to be quite as optimal as they were before. Never mind from one part of the brain to the other part of the brain, but also from that part of the brain to the bodily organ that it is supposed to be controlling, whether it's your movement or whether it's your bladder function or whether it's your breathing. Those connections can all be broken when you have a traumatic brain injury. The difficulty that we have in defining it, even from a medical perspective, when we do MRI scanning or CT scanning, for example, we can often see damage that comes from maybe broken blood vessels or areas of the brain that have been starved of oxygen and sort of die away. However, we cannot define at this point when those connections between different parts of the brain and between the brain and the rest of the body have been broken. It's very hard to define the impact of that traumatic brain injury on those connections. And this is why each traumatic brain injury patient is so different, and it's very difficult to predict what the outcome might be for that particular patient. There is very scarce information about the incidence and prevalence of traumatic brain injury within the UAE. I only managed to find 2 specific studies that were dealing with this, and they were both hospital specific. One was done in Dubai and one in Al Ain. However, the statistics were fairly similar in terms of sort of the groups, the categories of who ended up with a brain injury. In the UAE, and probably within this region, we tend to have a very high incidence coming from road traffic accidents, and that's whether it was car versus car or quite a significant amount of pedestrians versus car as well, where unfortunately somebody will end up with a traumatic brain injury. The second leading cause was, which is quite significantly lower percentage, was fall from a height, and that can largely be attributed to construction workers falling off high building sites, for example. After that, there were very small percentages coming from unintentional strikes to the head, or assault victims, or quite specific to this region, it wasn't really mentioned in Western studies, is that caused by animals. So I assume sort of animal farming and things like this, maybe falling off camels, for example. And that came up in the statistics for the UAE. This is quite significantly different to that occurring in the Western world. In the Western world, you tend to get like sort of 40%, and that comes from falls. So falls in the Western world is generally the larger proportion of traumatic brain injuries, whereas, like I said, 70% in the UAE and probably the Eastern region is, Middle East region anyway, is 70% is coming from road traffic accidents. In the West, again, the rest is sort of divided between assault, unintentional strikes, and road traffic accidents and other causes, as they say. So there's only about 10 to 20% of each of those causes in the Western world. What was significant to me in both of these areas was that neither of them mentioned traumatic brain injury from sports injuries. Many of you may be familiar with the new film Concussion that features Will Smith, which shows the devastating effect of smaller traumatic brain injuries that are recurring over time. And quite often these are not picked up. They're not picked up straight after the injury, during the sports game or whatever. Maybe somebody even hit their head fairly hard, I don't know, maybe on a window or a door as they walked past it, and they don't think about it at the time. But a recurring brain injury over time, or recurring series of minor to moderate brain injuries over time, can still have devastating impact. And the difficulties with these is that the cause of this brain injury is not often identified once they come to a health service. So they may come because of fatigue, they may come because of personality changes that their family have noticed. But the reason for these personality changes may not ever be attributed to the smaller traumatic brain injuries that these people have sustained. So this led to my topic for the presentation, which is called Traumatic Brain Injury, the Walking But Wounded. Quite often our brain injury survivors, even if they were recognized as a brain injury and went through the hospital system, quite often when they return to the communities, they look like perfectly normal people walking around, because we can't see their wounded brains that are not functioning to optimal capacity. The target audience has been identified on the website for the MENA conference, and in this target audience it is specified all the interdisciplinary team members, from physicians, all allied health professionals, for example. I truly believe that, well, and I hope that we have a great representation of all of these interdisciplinary professionals, from the ED and ICU all the way to those serving in the community or in residential or long-term care facilities. Brain injuries do move through this entire continuum of the healthcare services, and I also hope that potentially we could get some patients who have had traumatic brain injuries and their families, and even more importantly that we have some of our healthcare leaders and payers for healthcare attending these conferences, because I really believe that if we can get all of those involved in the healthcare spectrum to attend these conferences, we can gain greater awareness of the conditions that rehabilitation can be effective with, and the health strategies that might facilitate us being the most effective in rehabilitation. I think that rehab has two major roles in dealing with traumatic brain injury. Our first big role is in prevention strategies, and this would include physios being involved in falls prevention programs where we do some balance retraining and generalized fitness, especially for our elderly population and our rapidly growing elderly population. And our second strategy would be giving case examples and trying to get those who've suffered traumatic brain injuries as a result of road traffic accidents to try and encourage others for safer road practices and complying with legal requirements for driving. They're there for a reason, and obviously that is to keep us safe from such injuries. But using our own population who have suffered these devastating life changes from road traffic accidents can be a strong tool in trying to educate our population about the dangers and hazards of unsafe driving practices. Our second role obviously is in the treatment and management of those survivors of traumatic brain injury patients. We have big roles right from the day that these patients arrive in ICU until, like I said, they are lifelong conditions, traumatic brain injuries, and we need to manage them effectively across their lifespan once they've sustained such an injury. Like I said before, there's some imperative things that need to occur to make this rehab effective, and that is that it started very early. It's intensive. It is carried out by those who are very familiar with traumatic brain injury and experienced with those who suffer traumatic brain injuries. We need to also try and make sure that as a rehab team, right from the acute phases into community phases, that we work together to make sure that this is a seamless process for these patients. My topic is about navigating the pathway after traumatic brain injury, and that is often because it can feel like a maze to these patients. So it's our job as rehab professionals to facilitate this pathway. We have three main mechanisms that we use as rehab professionals in treating our patients with traumatic brain injury. The first is taking advantage of what we call neuroplasticity, and that is the brain's ability to adapt and change after a significant injury, create new connections, enhance connections that may not have been optimized prior to their injury, and in that way we can try and regain or maintain as much function as possible for these patients. Our second strategy is in preventing some of the devastating complications that can happen because the number and type of impairments is so significant in traumatic brain injury. One can have an impact on the other, and if they're not managed effectively from an early stage, they can often end up with very difficult complications to undo. For example, contractures in the muscle as a result of high tone for these patients. So we try and prevent those as much as we possibly can. And our third mechanism is obviously right from very early on, as a highly specialized team who understands traumatic brain injury, it is a huge responsibility of ours to provide education to the patient, to their families, to their communities, their workplaces, their friends, their families, to try and enhance the quality of life that they will have post their traumatic brain injury and maximize their potential and capacity afterwards. So we have a massive role, like I say, in education, and that's not just theoretical education, it's education in how to enable these patients to complete their life goals or their new life goals that they may have post sustaining their injuries. Points I would really like people to go away with from my presentation at the conference is that traumatic brain injury is a lifelong condition. Like I said, they may be walking and wounded out in the community. What we do know that there's been very successful programs in other parts of the world where these traumatic brain injury patients are managed on a lifetime perspective from the time of their injuries. They may not be having active healthcare treatment, but they are monitored all the time for what they may need, or they go through periods of emotional disturbance. They may go through periods where they might need intensive rehabilitation, and if they are case managed on a case-by-case basis over their lifespan, I do believe that rehabilitation at the right periods and intensively at the right periods is the way to optimize traumatic brain injury patients' ability to maximize their life potential. The second and third points I'd like people to take away with is that traumatic brain injury sufferers, as I said before, are often walking but wounded. Sometimes as health professionals we are in a hurry, and sometimes we've sort of try and find the immediate cause of what we think is going on, but sometimes we need to take a deeper look at what might be causing some of the symptoms for these patients. And if these patients aren't able to walk and talk to us, which is a large percentage of some of the very severe traumatic brain injury patients, again, it is our duty as healthcare professionals to really do thorough assessments and to keep ourselves up to date with the best practice that we can in order to facilitate the multiple and complex and integrated disabilities that these traumatic injury, brain injury patients can have, and the impact that one can have on another. For example, the pain that a brain injury patient might be feeling may impact significantly on the severity of the tone of this particular patient, which can lead to contractures and other even more painful conditions for this particular patient. So to pay attention to that, and that my greatest wish for these patients is that they would have highly specialized teams right from their ED and ICU stays to when they are out in the community, people who really understand their conditions, from their physicians to all their allied health professionals. If these professionals are all specialized in traumatic brain injury, what we do know is that the outcomes for these patients is significantly better. TBI is still relatively under-recognised and potentially under-recorded in the UAE. This Congress can be used from a number of perspectives, engaging rehab specialists a little bit more in prevention strategies. It can also be used to bring the most up-to-date and current practices to the UAE, to empower our rehab professionals in dealing with traumatic injury patients. And finally, I think even though we can bring internationally acclaimed best practices to the UAE, I think it's important for us to use this Congress as a means to make a network within nationally and regionally to adapt some of what is currently recommended in international best practice. I think most travelled professionals or rehabilitation professionals will certainly know that okay, there's evidence-based best practice, but it always requires a little bit of adaptation and cultural adaptation to perfectly or optimally work for each population that you might deal with. There's certainly certain practices and things that are encouraged in international TBI guidelines that definitely need a little bit of tweaking here and there to be culturally optimal for our environment in the UAE and the Middle East. And that is something I think as a group who are working here that we should be working towards, and I would obviously gladly like to be part of that group, and this conference can help us to form such a group. This just concludes this brief talk about our TBI. I hope that it's given you enough inspiration to attend our MENA Rehabilitation Conference. I would highly encourage you to attend. If it's not bringing any new information, at least we can meet each other as colleagues. My topic will be on traumatic brain injury and navigating the healthcare pathway after a traumatic brain injury in the UAE. This can often feel like a maze, not only to us as health professionals, but certainly to the patients. these patients suffer a huge number and a huge group of impairments that lead to significant functional difficulties for these patients. Managing these impairments and their functional limitations is also highly complex and requires, like I said before, a major interdisciplinary team. I just want to give one example that many of you will be familiar with. A lot of traumatic brain injury patients suffer with what we call spasticity. This is just one example of a maze that we have to deal with, patients have to deal with, families have to deal with in trying to manage. This is just one impairment that can also have huge functional limitations for the patient. For example, a patient who requires not only oral medication, they might require Botox and a baclofen pump. They generally have to go to potentially 3 different doctors to get these 3 services. They then need a physiotherapist, an occupational therapist to optimally manage the spasticity on top of the medication management. And again, it's a search for the right physiotherapist, the neurophysiotherapist who can deal with these. And on top of that, again, is the specialized equipment which they might need, and they again have to search for sometimes a different provider to provide the equipment. So that's the physicians they need, the therapists they need, and the equipment providers that these patients need. Even as health professionals, this is a challenge to us, so you can only imagine what this might feel like to a patient and a family who is trying to navigate the healthcare system after a traumatic brain injury. I believe that this conference can certainly help us network as professionals, which will allow us to facilitate these patients and their families through the healthcare pathway after their traumatic brain injury in the UAE. Thank you very much for listening and participating in this brief session, and I really hope I will see you at the conference, and I look forward to meeting you at the